Radiation therapy could kill your cancer in one giant blast. Doctors deliberately choose not to. Here's why that sounds insane and why it actually saves your life. 2 out of 3 cancer patients will get radiation therapy, and almost every single one is told the same thing. Show up every day, Monday to Friday, for 6 straight weeks. 30 visits, 30 doses, 30 drives to the hospital. Here's the strange part. The total dose is the same, around 60 Gray, the unit that measures how much radiation your tissue absorbs. But if you got it all in one blast, your healthy tissue would die. Skin burns, bowel fails, lungs scar. You'd survive the cancer and be killed by the cure. So doctors split the dose. And the reason that works comes down to one fact about your body almost nobody knows. Your healthy cells and your cancer cells do not repair damage at the same speed. That gap is the entire reason you live through treatment.
Every time a radiation beam hits your body, it snaps DNA, both strands, in cancer cells and healthy cells, equally. About 10 billion DNA breaks per session, in both. Here's what separates the two. Your healthy cells have fully working repair machinery. Within 6 hours, most of those breaks are patched. Clean welds, no errors. The cell survives and divides normally the next day. Cancer cells are different. To become cancer, a cell has to break its own safety systems, especially the DNA repair pathways. That's how they got out of control in the first place. They divide fast, but they fix damage slowly and sloppily. Broken welds, mismatched ends. And when the next dose hits, the damage stacks up. Radiobiologists call this the therapeutic window, the gap between how fast healthy tissue recovers and how slowly cancer recovers. 24 hours between doses is enough for your skin, your gut, your lungs to heal, but it's not enough for the tumour. Every fraction, the tumour falls further behind. By week 6, it's gone. One blast catches them both at the same moment. 30 fractions lets your body out-repair the tumour. Slowly, on purpose.
Repair is only the first of what radiobiologists call the 5 Rs. The others are just as weird and just as important. Reoxygenation. Tumours grow so fast they outrun their own blood supply. The centre of every tumour is starved of oxygen, and without oxygen, radiation barely works. So when the outer shell of the tumour dies in week 1, oxygen rushes into the core. Now those previously invulnerable cells become killable. Every fraction peels the tumour like an onion. Redistribution. Cells are only sensitive to radiation in certain phases of division. Hit them at the wrong moment and they survive. Over 30 sessions, you catch every cell at its most vulnerable phase at least once. Repopulation. Healthy tissue repopulates quickly between doses. Your skin, your blood count, your gut lining, they recover overnight. Tumours do not. Radiosensitivity. Different tumours respond at different doses. Prostate cancer needs around 74 Gray, breast cancer around 50, lymphoma just 30. The fractionation schedule is tuned to the specific cancer. 5 mechanisms. All of them only work if you give the tumour time. That's why the calendar is the treatment.
So if fractionation is so elegant, why is there a new trend toward fewer, bigger doses? It's called SBRT, stereotactic body radiation therapy. For small, well-defined tumours, doctors sometimes deliver the whole dose in 1 to 5 sessions instead of 30. How is that not a disaster? 2 things changed. First, imaging. CT, MRI, and cone beam scans let radiographers target the tumour to within 1 millimetre. Second, beam shaping. Modern linear accelerators fire from dozens of angles at once, each beam weak, all crossing at the tumour.
The healthy tissue along each individual beam gets almost nothing. SBRT ignores fractionation because it doesn't need it. If the beam only hits the tumour, you don't have to protect the healthy tissue by waiting. For most cancers, though, the tumour is too big, too irregular, or too close to something critical. And for those, 30 fractions is still the standard. It will be for decades. So the next time you drive someone to their radiation session, remember what that calendar is actually doing. It's giving their healthy cells a head start. Every 24 hours, their skin, their gut, their lungs are out repairing the cancer. The wait is the weapon. If you had cancer, would you pick one giant blast or 30 small ones? Tell me below. Yes for 1, no for 30. The full story is on the main channel. Link in the pinned comment.